My name is Goran and I'm coming from University of Kragujevac, actually Faculty of Engineering from Serbia. And also I would like to thank my good friends and colleagues Sasha Koceski from Faculty of Informatics at Štip, it's in North Macedonia, and my close associate Suzana Petrovic-Savic for their contribution for this brief overview of the enabling technologies for digital medicine and smart healthcare. Actually, we are opening a new research, so this is a part of our review of the state of the art in this field. So we felt it's a good idea to present what we found during this review of the current research results. All right, after a short introduction, I will switch to first concept that we are addressing here. That's a digital medicine, and after that to smart healthcare, and come up with a couple of conclusions at the end. What we are facing and witnessing every day actually is that world's population is increasing, and according to some resources, world population is increasing in a very steep manner and intensively. So a number of fields and areas are actually affected with such a situation. One of these is medicine and healthcare. So last at least couple of decades and even more, we are actually are witnessing a fusion between in this case medicine and digital technologies and information and communication technologies. These two groups of technologies, I should say, that actually revolutionize medicine and creating a completely new era with the medicine in its core, but helped with applied mathematics, medical physics, information and communication technologies, biomedical engineering methods and algorithms. Actually, we are now in the era of digital medicine and smart healthcare. None of these two very important concepts has a precise definition, but generally, digital medicine is devoted to solving medical problems and improve clinical diagnosis and treatment by application of digital technologies, devices, and equipment. Definitely, in this process, we are using a number of clinical assets together with the wearable medical devices, and not only wearable, but ingestible and implantable devices. On the other side, smart healthcare aims in integration of patients and doctors onto a common platform for intelligent health monitoring by analyzing day-to-day human activities. Also, for this, we are using a number of personal healthcare and medical devices. On one side, also we are sharing and communicating signals, data, and information we actually measured and acquired with such devices. And also we are using other network capabilities of, let's say, ground cables that are needed for a huge data transfer required for the hospitals and clinics. All right, when we are talking about digital medicine, it is actually founded and driven by novel hardware and software technologies that are spread all over the medical sector. And also such technologies are empowering patients which are not passive actors in this whole story. Patients actually are very, very active and providing a number of and actually huge data sets of their health traits and communicated to the network and the cloud for generating computational models and help doctors and clinicians to set correct and precise diagnosis and treatment protocols. In this age of digital medicine, patients actually are providing and controlled medical data about their body, and usually actually in one big segment they are doing that outside the hospitals. Another part of that let's say personal data sets are clinical based and are coming from digital assets that we have in our clinics, and which are actually all connected and can generate all the data we need. In such an environment, doctors are enabled to provide really high quality and data-driven interventions from one side, from diagnosis through interventions and further on for rehabilitation. In the architecture of the digital medical systems nowadays, we have several very important stakeholders. All right, patients and clinicians are on one side and very, very important, and patients are in the center of this concept. On the other side, new breakthroughs and new results are coming from physicians, scientists, and the strictly researchers on the other side, actually they are helping all of us to make all this working in a proper way. But what I'm going to pay your attention to is this very important stakeholder, which actually regulatory body or regulatory bodies. In this sense, this regulatory body is very, very important because such bodies are responsible for creation, maintenance, and enforcement of the regulatory policies that are important very, very much in this area. All right, investors are those people that are recognizing our efforts to make a better world for all of us. And since we are living in the era of big data, data scientists are very, very important just to create good algorithms for analysis of all this heterogeneous information and properly present to us. Digital medicine products can be classified in these three main categories: measurement products, which we use for diagnosis purposes, then for like digital biomarkers, and for measurement products in a clinical environment. On the other side, intervention products are very, very important. For instance, as the digital therapeutics or some very sophisticated digital equipment. For instance, here is the new Da Vinci robot for surgical purposes, which is also belongs to the digital medicine product. And finally, we have, here is this just a illustration for combined. Sometimes we have products of that kind that can measure and perform some kind of intervention in the same moment. Application areas are different, but we can recognize it in recovery, performance, and treatment selection, in real-time safety monitoring. We had just one presentation before this one. Then for the treatment adherence, for instance, for diabetes and some other diseases, it's very, very important. And multimodal data integration that I addressed, actually I mentioned that several times, is a very, very important application area. When we are talking about smart healthcare, smart healthcare as a concept and technology is aimed at providing healthcare system with information that are coming from sensors and to connect all the parties within a healthcare system. Also, healthcare system, smart healthcare system is here to compensate for the degrees of effectiveness of the traditional patient-doctor relationship, and in permanently increasing permanently increasing world population, and also to make more effective some medical services for the wide audience of the patients. Smart healthcare technology is based on services, medical devices, connectivity technologies, system management, applications, and end users. Actually, services span from customized communication on an individual level that we can find in our let's say wellness medical devices and applications, and when we are personally are actually using such a services, for instance, and it spans to the provision and interoperability for linked devices, diagnostic and treatment improvement, and community healthcare decision making and management, which is on a higher level of application of this technology in a clinical environment and in a community environment. For all of this, we are using intensively wearable, implantable, and ingestible medical devices and Internet of Things technology to connect all these devices, also with digital asset in a clinical environment. These medical devices, all right, we all know that it's the measure, collect, compute to a certain extent. It depends on device, and transmit users physiological and pathological information in real time, which is very, very important. So if we are using smart watches or bracelets, we can use them for tracking the patients with some chronic disease like epileptic seizures, for instance, or diabetes and so on. So we can automatically alert the clinic and the emergency in the case of some alert situation for these patients. Also, smart suits, fabric-based items, and stretchable bands are becoming more and more affordable for patients. Also, implantable sensors. I'm not quite sure if it started in orthopedics first, but also we have implantable sensors in ophthalmology and in dentistry and so on. So we can gather a number of data to deeply understand what's going on in some let's say places in a human body which is not accessible so easily. So we can help in creation, design of better implants like prostheses and so on. And also ingestible sensors that are nowadays are becoming more important, like digital pills and pill cameras. And for instance, FDA gave the green light for a number of products like this. Connectivity technology actually are based on one side on low power consuming wireless technology which is very important for the permanent monitoring and transmission of the data about the human body state, and also very important, and also for the Internet of Things counterpart of this technology, and also ground network, cable network is very important for the huge data set and the heavy data traffic to establish between all the devices in this system. System management is in general 3-layer architecture. It starts from the things layer and goes via communication layer to the processing layer. It sounds very easy to create such a system and to implement, but in general it is still very tricky, and there are a number of issues that are still have to be covered in this sense. Among these are actually safety issues and incomplete data, lost data, and things like that. So it is not interrupted data transfer since we are using personal medical devices quite often, and so on. Applications also we can classify into fitness, which are more or less for the personal use, but we can be connected with our personal health electronic health record. So such data from our fitness devices are also very valuable for complete diagnosis of our health state. Further, home care, including ambient assisted living, another kind of applications, and finally clinical and hospital care, which is on the highest level applications that are supposed to connect all of these applications at the lower level. And finally, end users, and that are all of us actually. We have users that are striving for a healthy life, mostly healthy and young people, to the patients who require permanent health monitoring, like old people or some people with chronic diseases and some heavy disorders. And finally, to the community and regional healthcare administration and government, which has become very clear during this COVID-19 pandemic. So we can use a number of personal medical devices to detect some states, health states, and help the community and regional authorities to prescribe some measures for protection. Well, to conclude this, this interweaved connection between digital medicine and smart healthcare actually provide this all these benefits that we can list in separately for this these two technologies. Which are the benefits? Wide accessibility and availability of medical services when and where it's needed. Profiling and personalizing medical services, which is nowadays very important. Reduction of expenses and costs through healthcare. Relief of pressure on medical staff. Again, we were witnessing that last year. Improve and management of processes and assets in medical institutions. Help governmental bodies and institutions in strategy making, policy creation, and promotion and implementation of prevention of concepts and models. Okay, these are benefits. Just for short, it is a long way to establish full benefits. So I will just mention a couple of open issues in this sense. That's standardization and legal aspects of application of these two technologies, and finally safety of all these data. There are some reports on hacking of some medical devices that are used for chronic patients monitoring. So safety of this healthcare Internet of Things is very, 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 very important. Okay, that's it. Thank you very much.